should be on. Cameras should be on, just because tomorrow it should not be a problem for you guys. Okay?
Yeah.
Don't know whether our this lady is coming or not. I was waiting for her, but I don't know whether she's coming. I'll give a last. Don't know why it's so strange. How was the weekend? Long weekend for you guys. Enjoyed?
Yeah. Got paid for yesterday. Double
That
pay.
is good. That is good. That's wonderful. How about you, Pimi? Did you work? Pima? Did you?
No, I don't work.
You don't work. So you got paid at home.
Yeah.
Let's check last time is the student coming or not. And then anyways, if somebody has to come, they will come. So for today, we would be throwing just because I finished. It's good, Pima, that you will get a chance to know each and everything. Because I was doing chapters first, and we reached to chapter 9 that we were supposed to cover today. But I just only covered only one link with you guys. That was the Maslow's theory, remember? So we will be covering all the links today so that we will come to a point where we don't miss anything. At any point, if you guys need a break, you have any question, there's something that you don't understand, I'm going fast, or I'm not audible, please feel free to ask. Okay? And other than that, Prima, did you get your Evolve, what's it called, link? Everything that I teach, when you go on your Evolve, Amrit, you got your Evolve, right? When you log in, on the side, you will see whatever I teach, whatever help, notes, presentations, whatever you guys need, that would be available there. Even if you still find it difficult, I can always forward you the slides. That's not a problem. Okay? And let me get connected with this one first with our, where is our Evolve, and we'll finish it up. Okay. So, our, I think, and okay. Oh, We are going to go one by one on each link. The first link that we have today here is the ALS Society of Canada. I wanted to share my screen. Is it possible? Yes. So you guys can be able to see. Nima, we need to put the camera on, my dear, just because this is again the rule. Everybody else is having the cameras on, just because it's mandatory when we are discussing class on Zoom. So today's topic is when if I have ALS, if I have Alzheimer's, what do I focus on? It says first and foremost thing, what about ALS? What is ALS? When we talk about ALS, it is a disease that we say a bone deformity. Okay, quickly. This disease is a disease that is progressively paralyzing people just because the brain no longer can communicate between the body and it cannot send impulses. Because of that, you will see people who are hemiplegic, paraplegic, quadriplegic, which becomes total care for you guys in everywhere you work. So typically, it means those people who are suffering from ALS, they cannot move. They need your help to get repositioned in bed. They need your help to get their activities of daily living done. They need their help even when we say feeding, when we say some of them would not be able to even communicate properly their needs, because once the brain is affected, your speech is affected as well. Okay. Now, when you see when you see what we do now for this signs and symptoms, how this is diagnosed, how is it affecting people's. Yeah. When we say ALS, I told you the people, they lose the ability to walk, talk, hear, swallow. Brain is the thing that our brain communicates with each and every organ. Our brain sends impulses. When impulses cannot be sent, we are not able to get anything done. However, when we talk about these people who are with ALS, you do not work alone again. You initially start with occupational therapist who would help you to go forward with what your plan will be. You will have most of the people who are having ALS, they do also have private caregivers. Just because you are with them, they still are not able to do any of their activities. If they're younger people, they might have private caregiver as well. These people get home help minimum 4 times a day. Saying for home health means a support worker would go 4 times to cover morning, lunch, dinner, and then it would be the midnight. Just because he or she has no ability to pee, he or she is incontinent, would be a big bed wetter. You will have to go, just get the breathing done, go out. This is your 15, this is one of your clients. At night, you will see 3 clients, 4 clients, and the maximum you do is just a brief change and done. And then, but you get paid for your 12 hours. That's when we say you have 4 clients, 5 clients. Okay. This is what you need to know about this one. Let's see what the other slide is. Any questions here? No. With people who are on ALS, you also act as advocates. Not all the time, you might not be providing care, but you are also advocating for different kind of cares. Okay? Okay. Let me get another slide here. Hold on, my dear. Let's see these. You guys can see it. This one is done. It's nothing, but we still have to go and cover each and every slide. Shah, don't touch.
ايوه هذا الجول لازم في شيء ورنت الليل في كل المستشفى امس في دي بعدين في ساعه 5 دبل امس على طول كيلو بعد الشغل كيلو مستشفى بعدين امس في العصر في 5 في خلاص في اشاره دهري في ثاني اشاره كبير
Alzheimer's Science of Canada. This is another. Are you able to see new share? Okay. The other link that we have is here. Is this one? Are you able to see my screen? Alzheimer's Society. People who have Alzheimer's and who are dealing with Alzheimer's again. Dementiated people. What you do, the same thing. What you know about what you should know about these Alzheimer's is that they have dementia. Dementia can lead them for falls. Dementia can make them have aggressive behavior. Dementia can also create last trouble is sundowning. There's one specific time. It does not matter. Some people sleep through the night. When it is around 6 o'clock in the morning, they start to tend to get kind of mad. They try to open their clothes. They want to come out of the bed. They do things where we have to put them somewhere, either in restraints or we give them medications. Mostly these people who have Alzheimer's or who have dementia are old adult. They are frail. They are at a risk for injury, head injuries, and hip injuries. Please make sure when you're dealing with people with these two things. One, if it's less than age of 65, you always will see in the in your workplace, you will have a pamphlet. We give it to them and we explain it to them. By chance, do you want to be a donor? Just because you are less than 65, we can always use your eyes. We can always use the other body organs. When it's the time, you might pass. So this is what we talk about Alzheimer's Society, only if they are less than 65. If they are above 65, we do not ask them for donating eyes. We do not ask them for kidney donation or for other liver transplants, because we do otherwise. What we do is, if they wish to give or if they wish to be a donor, we always put on their file. You will bring that pamphlet, they will sign it off, then you will give it to the nurse. The nurse will put it in his or her file, and when, if ever they pass out, they will be taken straight away to the morgue, and from there but before that they will have to get through some tests so that there's no HIV, hepatitis C, those things. Okay. And how You don't say, "Oh, would you be a donor?" No, you will. What the way you say is, "Yeah, I'm just concerned. That we have here a policy for every client that comes to us. We do tell them about our donor policy, and we would like you that if ever you want to help the community, if ever do you want your mom or your loved ones to live the life in not only now but in some other person's perspectives, they would say, "Oh, what do you mean? Here's that pamphlet, would you like to go over with it? Yes or no?" If she says, "I don't have time, I can't read," will you like me to explain it to you? Then you go on. Say, just because you're less than 65, we are supposed to say it's not just because you're dying or something, but less than 65. We always have to explain this reason, and we have to ask a consent that, can you be a donor for us? You can really change the world. You can see the world, the other person, and you yourself can see the world. Saying means that your loved ones, they will be seen by somebody's eyes. That person can also see, and you can also see your loved ones are again back to life, kind of. So that's how we manipulate and get our donors. That's your job, to get those pamphlets and just to give them. If they are ready, they will talk to the nurse about all these things and go ahead. They will be then taken for some tests, and from there the procedure goes on. And the last thing that we do is, if they pass out, they're not being sent for funeral homes and all, they're sent to morgue. From morgue, they're taken for the donors by the donor society. Let's see what else is there in this one. Donate now. I'm worried I may have dementia. I'm worried someone might. So no reason. And I'm recently okay. Now, another thing that I want to tell you is, when we talk about I am recently diagnosed, what sign and symptoms would we see? We would see some patients, some clients, some residents show drastic change. Means just before couple of days, they know who they are, where they are, what do they do, who I am, what's going on in their life. But suddenly they do go down. They have an underlying cause as well, saying maybe a cancer, prostate cancer, ovarian cancer, any cancer. And at the same time, looking at the age, they get confused. They start with initially with a mild confusion. I don't remember the date, and they say, now I'm not working, I'm old, I only read newspapers, so I don't I don't have a newspaper. I can't tell you the time. I can tell you the date. Your job is, if you tell them the date, after 5 minutes, reassure yourself that this patient or this client or this resident is not confused by asking, I just told you the date and the time a few minutes ago. Would you mind telling me? So that will tell you, is this patient, is this resident, is this client dementia going for dementia? Is he going to get recently diagnosed with dementia? Another thing, sometimes we are also very bad at dates and might not remember. If we are home and we haven't been out working, we might not remember what date it is. The best way to check your patient, check your client, or to check your resident is, take them to the bed, hand them the call bell, and tell them, if you need any help, press the call bell. Can you try it? If they try it, it means they're with it. If they don't, only say yes, yes, but they don't press it, what did you tell them? Do you understand what I mean? That's your best test. Date and time always gets confused. Everybody gets confused. Cannot be the right one just because they are elderly, they don't work, and things benefit our doubt. But when you are giving someone a thing, saying, hey, this is your call bell. Whenever you need help, you will press this call bell. I'll come and help you. For now, can you press the call bell? So that will give you a time to know your client is now going to get recently diagnosed. Another thing you might hear is saying CAM score, confusion, assessment. This is, do you see any new changes in the client? Yes or no? If he is climbing out of the bed, if he is restless, he's pulling his clothes, he's trying to strangle with the IVs and stuff, you would say yes. Is he vigilant? Is he sleepy? What is he? You would put this. If ever any, there are 4 boxes. One is, do you see any new changes? If yes, what is the change? Do you see this patient or this client or resident is alert or sleepy, drowsy, or hyper alert? Based on this, you would tick the box. If out of any 4 boxes, 2 are there, that means this resident, client, or patient, whatever you are working in, whatever scenario you are working with, it means he's recently going to get diagnosed. And we don't diagnose them right away just because this shift, this person got 2 boxes. We do it every shift. Every shift means twice in a day. Day shift, night shift. Then we compare them, and then we create that trail saying, hey, this is going to stop. Sometimes your patient absolutely knows, I live in this residential home. This is the date, this is my name, this is my date of birth. Suddenly, he would say, can you take this child out of my bed? They hallucinate. They have those hallucinations. There's a war going on. It could be 2 reasons. One, underlying any infection. Right away, ask your nurse, hey, these are some appropriate words the client is saying. Can you take the vitals? If ever you're working in a setting where you are already been trained with vitals, then it's your job. It depends what setting you're working with. You take the vitals, especially in vitals, that time your most important vital is temperature. Do not miss. Most of the people take blood pressure, pulse, SpO2, but do not take temperature. Temperature is the biggest key. Biggest key when you're diagnosing people with dementia, when you're diagnosing people with infections. We really don't pay attention. Some people really don't pay attention. This is the key you need to pay attention to. And what kind of support we can offer? We can sit down, we can reassure them, we can redirect them so that we can settle them back in bed. That's us, how we do, how we really help them. Attention dementia researchers apply now. We don't have to. So you guys saw this. This is part of your course, unfortunately, that you have to see all these things. But I would throw little light on each one of that things just to make sure that at least this is.
Excuse me. Yeah, are hallucinations related to dementia, or like there can be other causes of
There are other causes as well, but some people they also hallucinate because of dementia. Infection, UTI infections also cause hallucinations. If a person is a heavy drinker and they have what we call as ETOH, withdrawal syndromes, they can get hallucinations. But generally, those hallucinations, they are young people, they would be on a SIVA score. That means if they're hallucinating, if they have that precipitation, if you see they have tremors, we are not talking about, we are only talking about hallucinations that he or she might see. And you know what? The worst part of hallucination is God is calling me. Jesus is calling me. Can you see that baby Jesus there? This you will see in every residential home. This is so common that I don't know how they can see those babies. This common scenario happens. You have to let them know. You know what? There's no baby there. Try to redirect them. If they get aggressive, if they get angry, because when you tell them you can see it, not others can see, they might get very, very aggressive. They might start to hit, they might throw things. So always watch out for your space, please. Don't be so near that you can get punched, stabbed, right? So you have to look onto that things as well. See what we have, yeah. And it's talking about, let's go through this one. I feel like this is, you know what? 7 things you may know about vascular dementia. Vascular dementia is the most common form of dementia, but how much do you know about it? It says stroke is one of the common cause of vascular dementia. It happens when there's a damage to the brain, there's lack of blood cannot flow from the brain to the organ. This is one. The other thing is if it gets busted or blocked, that can cause damage to the brain. Stroke, you would say it may lead to vascular dementia. Other different types of vascular dementia is subcortical dementia and cerebral amyloid angiopathy. In these two are not really very, very common, but when you see clients, resident patients, they are always suffering from stroke. Stroke is most common thing that you would see, especially in Canada. Our population, 70% of the people are suffering with stroke. Every day you would see people coming to the hospital. Out of 10, 5 people will have a stroke. Their query stroke. What happened? And then some people are very lucky enough, they don't lose their motor skills. Some people, they lose motor skills. They might have that facial droop. They might get weakness either on the right side or on their left side. Again, dependence on us. Okay. And when we say about these symptoms, they grow slowly. The person is not able to notice these things. They lose the ability to make decision, plan, organize. They become slow. They can't move. They have poor balance. As I mentioned, they're a very risk of fall. Especially they can hit their head and hip joints. If it's a male, it still would be a bit okay, but if it's a women are more prone to hip fractures just because of elderly in the elderly age, they are at a more risk for osteoarthritis. And day by day, this vascular dementia keeps on and on. Why is she here? What are you doing? You don't have to do. I need to go back to work. I need to do. Now, let's say you have a client or you have two clients and both of them have vascular dementia. You're working with them and they're very hard to redirect. What would be your possible skill that you can use that comes to your brain other than medication? The client, the resident doesn't want to take medication. The family does not want you to give the medication. Refused. What and how we can now manage things? Any idea? Or have you ever heard? Remember, if you're working in a setting which is residential setting, client or client's place or anywhere, grab some towels, small towels, they always have, give them and try to make them feel like, let's fold these towels. If they are a runner or they don't know, they're climbing out, oh my God, you're such a good helper. Start with the words. Oh my God, you're such a good helper. I would like you to help me. Would you mind helping me folding these? Once they start to fold, they think they are doing a favor to you. They slow not the process slows down, but the mood of that angerness and that intense slope goes down. Before, they do not want to listen to you. Now they think they are doing a favor for you, so they try to settle down, settle down. Oh, now can I get a glass of juice for you? No. Okay, would you like to have some cookie? That's how. And if this doesn't work, it's an because they get confused every day. She doesn't want to fold clothes today. She doesn't want to fold these towels. When you are giving, try to get these are things that you would see, and these are things that you should really be doing to progress. What you do, grab a number of cookies and do not offer this person first. Offer others. Already get your nurse to crush the, if it's a jam, we do keep jam cookies in residential or what we say community homes, just because we know people get confused and we don't have any help at that point. We can go to the market and get it. So we always have some. Or go to the kitchen, ask them, can you give me a number of cookies or number of juice or something where you can hide this crushed medication. So what you do, put this crushed medication on a plate and surround it with good ones. Start giving these good ones to others. When it will be one or two left, do you want to eat one? Because they see others are having it already. That time they, if you specifically go and say, hey, I have this cookie, Maria, for you, she will never take it. She has that time sense that it's only me who is taking this. There's something wrong. They get more paranoid. So what you do, go to the kitchen, go to the fridge, grab juice or cookies, whatever is available for you guys. Let your nurse know, okay, let's put it in this one. And then put those juices or tea for every, oh, this is time for tea. Who's the one who all are going to have some tea? Many people will come. Start handing over that tea to the people. And once you see, oh, would you like offer? Yes. You already had created one, you give it. So your job is always, I'm again telling you, an art. If you know your art, how to survive, definitely you will be the one to success. You have to be a very big manipulator when it comes to this, just because you are dealing with mostly either it will be newborns and young, or it would be older adults. They really don't know anything. They really don't remember anything. They have no clue of what is going around them. some might know their name, some might know their date, but they don't remember anything else. And also, I have seen some people get better if you take them, and every area, every facility, every hospital, every place has a window. Oh, let's see from here. Do you want to come and see what's going on outside? They feel like, okay, that's how you can turn the attention towards some other things other than getting angry, other than getting to a point where they escalate and it becomes a situation where we end up with security, police, and family issues. Okay? And having a stroke, if more than double the time, the risk of developing dementia is more. If we got COVID several times, yes, we might have respiratory infections. Simply, if we see a person who has had a stroke, maybe he or she got lucky the first time, did not end up with any motor deficits, but definitely this time it might add to some more problems. Now, how we are going to manage risk factors, especially take care of blood pressure, smoking, stress, unhealthy weight, unhealthy diet. And when we say stroke, remember this acronym. We have FAST. Face, is it drooping? Like it will become like this. Arms, we ask them, hey, can you raise your, when they like it just, because once you ask me to raise my hands will stay up. Even if you help them to keep their hands up, it would. This is. And speech, you will see they have that slurred speech, jumbled speech, because of the drooping, because of that you cannot and time. And that's the time when you see there's a facial droop, when you see the arms, they cannot raise their arms. If you see their mumbled words, if you see, and especially the facial bones, or you can say the smile, it's not equal. It is one side you feel like this, and the other side is like this. That time is the time to call 911. In residential cares, doctors do not come every day. You don't have a doctor or emergency. If anything happens, you right away send them to the hospital. Any independent living, any community, anywhere where you work, which is not a hospital setting. Hospital, the other name for hospital is acute care setting. If it's not an acute care setting, the next would be call 911 and they will be taken to the hospital. If they are in the home, you're providing home care, you're giving private care, that's the time when you call 911. High cholesterol and heavy alcohol use, drug abuse. It is, we all know Canada, the drug is very easily available. And when we say high blood pressure, hypertension, also remember, some people might be symptomatic, some people might be asymptomatic. Sometimes you will see people who have slightly blood pressure a little high today, and they tell you, oh, I don't know, I'm feeling dizzy, I'm having headache. That means they do have symptoms. But some people, their blood pressure is so high, it's around touching the borders of danger. But if you ask them, do you have any pain, any headache, any dizziness? No. Reason, they're dementiated. They don't know what and how this pain or headache feels like. They cannot explain. That's when they, or it might not be there. That's when we say asymptomatic. And most of the people who have hypertension also have diabetes. Diabetes and hypertension go hand to hand. They are just like girlfriend, boyfriend. If the girlfriend is in the shopping mall, the boyfriend would be there. Same, if this person has hypertension, there will be a point he or she is at a very high risk of having diabetes. Now, again, coming back to this lifestyle management, but it can be reduced if we figure out how we can create a healthy living lifestyle. If we are doing a yoga, physical exercise, physiotherapies, singing classes, music classes, some recreational things, it reduces stress, tension. Think about this. When you are in stress every day, every day, every day, what are you doing? You are really ending up in a state where you're burnout and you are trying to end up your good brain cells. Stress is really very, very harmful. Okay, let's see if we missed anything here. Risk factors, no, we talked about that. Dementia is the most common cause. Yeah. So, okay. Our next topic, let it open and I don't know what it is. Machine. Yes. When we say palliative care, I already have explained it, but I would just go a little bit again over it. People who are in a life-threatening danger, who are at the end of life care, are called as palliative care, saying a person is newly diagnosed with cancer, oral cancer, liver cancer, lung cancer, any CA, and they say, oh, you know what, it's spreading. We don't know. The prognosis of this is he or she can live for 3 months, 4 months, 6 months. And we are deciding we don't want our loved ones to be in a bad situation. We want them to be in a good situation. So what we do is we send them for palliative care. Palliative care means we are not giving them IVs. We don't check their blood pressure every single day. It's once a month, blood pressure needs to be checked. But they live in a subacute hospital setting. It's already a part of hospital, but it's subacute, where vitals are not being done, where IVs are not done, injections are not being given quite often, other than if it's a blood thinner or any important one, being sick. Otherwise, we don't give all those things. We only provide them comfort care. This is your blood pressure bill. Yes. No, I don't want it. Okay, leave it. We focus on oral care. They have dry skin. Their mucosa gets dry, so fragile, they can bleed. They can get mouth ulcers, they get and they can get infections. That's what when we say. And when we say this palliative care, the major thing that we have to remember is palliative means pain management. We do not want them to be in pain. When I said no IVs, when I said we don't do those things, does not mean we don't give them injections. There's only we poke them one time. That's we put a butterfly. When we go to the lab, I'll show you this butterfly. We will put it on one arm. It stays there forever. We label it with what drug, because this cannot be used with two drugs. Even if it's the same drug, but the quantity is different, you cannot use it. So please make sure and remember what I am saying. I don't know whether you guys have heard about the name Dilaudid or Hydromor. So if this patient has been recently diagnosed with cancer or has too much pain, is now on Hydromor. We don't, and orally, she cannot swallow. There are thick lesions in the esophagus, and it's very hard for the patient to swallow. It becomes painful. We don't want her to be in more pain. So what we do, we put a butterfly. It just very simple. And there's a small amount that already stays, which is called priming. We already prime it stays there, then we use it. And if we are using 0.5, we put it hydromorph, or the other name of hydromorph is Dilaudid 0.5. And then it doesn't hurt. If there is 2, they might be on 2. It can be on a thigh. It's sub-Q means not in, it's just superficially involved. And that's when we manage their pain, because we don't know how they are, how they feel, if they are grimacing. Some people really don't know how pain to them is. And there's so much suffering bad that they might fall, they end up being confused. They're not confused, they're just having pain, but they don't know how to express. Again, pick up signs of pain, try to provide empathy, sympathy to the patient, hold the hand if it's very elderly. Hey, how are you doing? See, when you touch the hand, you will feel, is this patient cold? Is this patient clammy? Is this patient warm? That will tell you that is that, and sometimes you would see their hands, they are blue. That means the blood flow is not really good. It's not running nicely. Just because they have underlying diseases, they're having this terminal illness, cancer, then on. So these things, when we give them medications, they dry up their mucosa. We would provide them with oral care. Get a sponge, get some mouthwash, get some water, and every often. Then you give them the lip Vaseline. You will apply it with that sponge. Do not you put your finger ever in your patient's mouth, or just want to put and you will put it. If you don't know that patient is aggressive, is confused, he might bite you. Whenever you are providing care, safety first. For God's sake, safety first. If you have to apply, if you have to do something, you will always do it with a sponge, not with your finger. Never more than this close to your patient's mouth. When you are feeding, you have tactics on feeding. Would you sit on the patient or the client's side that is deformed? that is not working, or would you sit on the good side? Think of it. How would it be easy to feed the patient? On the good side or on the bad side?
Bad side.
Bad side.
Okay. And which side you will sit?
On the
On
good
the bad
side.
side.
And feeding, after sitting on a bad side, then what would you do? You guys said bad side, right? Let's see when we come.
For feeding, don't you have to sit on the good side so you can feed them properly?
Yeah. So what we do when you guys come, you will practice and see on the right. You will pretend, one of you will pretend, you guys will pretend to have this bad side. We'll close it, and then we'll try to tell you now to move and see how this works. The main reason for me to go over this is I could have told you go over with these, but it's just that we can discuss lots and lots of scenarios going on. People have arthritis. Have you seen their hands? Do they have straight hands? No, their hands are crooked, kind of. They are weak. Are they able to hold the... No. Remember, we don't use for people, for your clients who have these deformities, we don't use the same kind of, we can say, utensils, spoons, plates, glasses. They're special ones that are meant for these disabled people, that are meant when you're not able to hold properly. And if they have deformed feet, trust me, if this is, some people have like this, we do have shoes. They're specially made, specially organized for arthritic foot. They don't, when you put them together, they don't align like this. They're like this. It's just that the foot is... Other thing, I just remembered, when you are putting your client, resident, patient on a wheelchair, make sure if you are putting the flaps, foot flaps on, close them properly. If you don't lock them, you ask them to put their feet on, they might trip over. Did you get what I mean to say? When they have these wheelchairs, on the wheelchairs, there's like a, you take them out. If you have to get the patient out of the bed or your resident out of the bed, you never put those on, because if you are trying to get this patient out of the bed, he might hit it, and they're elderly, they are on blood thinners. Again, they are at a risk for injury. So what we do, how we put them from wheelchair to the bed and from bed to the wheelchair, we just remove those side flappers, and then we will make them sit. Once they sit, you just hook them up, flip them in. It should make a sound, click sound. It means it's closed. Then you ask them, can you now rest your feet on this one? Okay. Then can you do this second time? And then this is how you manage the safety of your patient. If you don't do that, it's open. While you're walking, those flips will hit the patients and they can get fractured. When, if you know or may not be knowing this, this is a long bone. Our legs are long bones. Long bones are a source of fat because our RBCs are produced there. So it can be a fat embolus. If it breaks, it can travel to the heart and it can cause death. Okay. It says it's important to be diligent in providing oral care evaluating oral care needs on daily basis. Yes, we do that. We make sure that it's being done. These are all sources of oral pain and discomfort. Dryness, coating, I told you all this. Dry mouth and but do not, please, please, please make sure, do not just like this go over with it. No. Dentures. And if you have a client, he uses dentures, make sure you remove those dentures at night. Those dentures are so painful if they are left. Not only that, but they are not clean, they are not being brushed, they are still in their mouth, becomes a source of infection. Okay. This one. What's next here? These, see, the periodontal ones, bacterial infection. If there's an infection in the tooth, any tooth is affected, it can simply reach the blood. And blood flows to each and every organ. That means you might get infection anywhere or every organ, which is sepsis. Because tooth is connected to a nerve, nerves are connected with blood vessels and directly get, if there's a skin infection, no, because our skin has 7 layers, we might not get right away affected. But if it's the tooth itself has nerves, has connections, has blood vessels, and when there's a decay, there's an infection in this is carried from one small nerve to blood vessel to another, might end up to heart. And that time, the patient's temperature is high, we call it sepsis, or very low blood pressure. There are 2 times when we say this patient has sepsis, either high blood pressure and high temperature, either low blood pressure and low temperature, very low, less than normal, 35.4, 36.1. So that's when you, so do not put these dentures in there. Make sure you take them out, get a container, first wash them, then put them in a container, get some fresh water, put it, get the label, get the container label, and that's it. If you don't have a label, you always have marker pens. Bring a marker pen, write the initials and done. That's how you protect yourself. Especially remember any person who has a tooth decay or has a tooth infection might end with a disease called bacteremia, and not disease, infection called bacteremia. That is bacteria in the blood and it goes to every organ. It affects your brain. It looks like you have a stroke. It looks like the patient is confused, is restless, will have every symptom. All organs would be affected one after another because this tooth infection was carried by our blood vessel. And now, taste swallowing disorder, yes. So if they're elderly, they've already lost the sense of taste. They cannot tell you. But this area is more prone to lose sensations. But when you go on this side, at the extreme end, it's good. You can always get a tongue depressor and try to check. Then you can put some with a Q-tip, apply some salt, apply some sugar, and let the client tell you what kind of flavor, what sense did he get from it. That is when you can check, has he lost or has she lost her sense? Can he differentiate what is sour, what is bitter, what is salty, what is raw? This swallowing disorder, some people might eat too much and then they use their thumb to throw up. They don't throw up, but they just want to do that. Binge eating. They first take more than extra, then they induce themselves vomiting. The opposite of it is anorexia nervosa, where they feel like they're going to grow fat. They don't even touch food. They become like stick, hardly a stick. So thin. So one being thin, anorexia nervosa, another being bulky because we eat too much, and then I want to induce and throw up. That's called binging. Okay. You will see those people. What we do, we will get a soft restraint or mittens, sometimes mittens, and this mitten is like a thumb and this, and then it has a velcros, so you put on both hands so that they cannot put their hand inside their mouth. And that mitten is not a small mitten like this, it can go, no, it's like a ball shape with one thumb in like this, and then we do have all those things in the lab. We will practice that, but for now we know that. So the tongue cannot push the food. Yes. Do you know when we say the tongue cannot push the food with throat and chewing, what exactly happens? The amount of saliva in our body, in their mouth, just because they're elderly, it uh, tends to be less. And we can swallow when the food is moist. If they put food in their mouth, even though it's minced, if it's not moist, it cannot be taken. Have you ever eaten hard rice? Can you swallow? No. Maybe you might have swallowed, but did you like it? No. Okay. Swallowing is improved when the mouth is moist and treating because it becomes a ball and it can be taken down. Ensuring the food is moist. Pre-blending food to make food possible size, possibly smaller and more manageable. We have how many types of diets do you know? You need to know these. You don't need to know diseases, but you need to know the name of the diets. Any idea what can be the name of the diets that you should be knowing and you will be helping? Number one, you might see diabetic diet. Diabetic diet means there will be a boost, there will be something which is sweet, and it can be any rice or juice, soup. If it's cardiac diet, remember cardiac diet means you will not give more water. It is less than 1.5 liters of water you can give, because the rest portion is given by the kitchen in the form of soup, milk, juice, and what else? I'm so tired today. Sorry about it. So that's when you say, and also when we say about cardiac diet, making sure the salt is less than 2 grams per day. Again, when you see cardiac diet, less than 2 grams of sodium per day, and then you will have less than 1.5 liters of water or any liquid, juice, cola, blah, blah, blah. Now you would say, how does it matter? Why should I know the trace? If you are If I tell you, hey, you know what? This patient is diabetic, has a diabetic diet. What would you do? Can you bring a regular tray? No. That means there are some things that she might not be able to eat or might be able to eat, but that would not serve the purpose. We have in a diabetic diet, we have a boost, ensure all the time. And then we have minced diet. Minced, if you have to make meatballs, it's not really 100% crushed, but it's like the more crushed amount is 70 to 75%. It's like the mincemeat that we say. Other than that, we have dysphagic diet. When we say dysphagic diet, we have dysphagic thin, dysphagic thick. It means she's not able to swallow, but she's dysphagic thin, might not take water, but other drinks. Dysphagic thick means he cannot drink water or any other juice, needs to drink something which is thick, can be swallowed easily. Yeah. Let's take a quick break, 10 minutes break, and we'll come back at 10 o'clock. So sleepy today. Is there any question for now?
There's the thing and the management thing. On the slide, you're using a suction machine if available, or
No.
wrapping a thin.
You don't suction. Okay, suctioning.
Okay, fine.
Yes. Suctioning is only if when the time comes to suction is when you are being trained or your employer. Remember the policy. If they told you, yes, you can suction. And
No, I was coming to the last line. Remove food debris from the cheeks and under the tongue.
yes, they will pocket. They do pocketing.
Okay.
You go feed them here, then here, then here, then here. Okay.
Then how do you remove it by not putting your hand in the mouth?
No, we have a it's everywhere the same standard. It's like a probe.
We have an instrument for that.
Yes.
Okay,
And
that's it.
just superficially, we blow oxygen into it. That will take it out.
Yeah.
Sometimes we also tell them, can you gargle? But no, if you can't have anything, grab a tongue depressor and with a spoon, sponge, but no finger. We did have accidents in hospitals where the co-workers have lost their small digit because they were like, and they got bit. So we always use a tongue depressor, a spoon, sponge. If ever we are not able to do a suction. Otherwise, we always remove. Anything can be removed with suctioning. When it comes to you, if you are given a chance, your employer will give you a chance, or you will be given advanced training. You only do superficial training. That is, they lie like this back, and a lot of saliva gets accumulated in their mouth. In the oral care, which is a really small area, the tongue area, you can. Deep suctioning over the throat is not LPNs can do, licensed, it's only the RMs can do. Because they think if you put too much of oxygen, suctioning, it really not might, it sometimes peels the inner lining of the cheek. So that's why they don't want you to go in the cheek, on the cheek, only between the skin hair and the teeth and under the tongue. That's called superficial. Okay, let's take How long do you want to take a break? Do you want to take?
I have a question.
Yes, my dear.
So back to the cancer, you said that some of them you have to give them IV and like medicine, and then some of them you don't give it to them. Why is that? Do you just let them die and like
Just because
let them have their 3 months?
no, no. You remember I told you it depends on the most. It depends of what you picked, how you want your quality of life. If I told you that there is called DNR M1, DNR M2, DNR M3, CPC1, which is say full code. Full code means you will do anything and everything to make me survive, including suctioning electric currents and including all giving medications, providing oxygen. We say DNR M3, that means do not resuscitate, no electric currents to be given, shock. You will not give me any shock, you will only resuscitate and give IVs. When we say DNR C1, you don't do vitals. C1, you don't do vitals, and C1, you don't give IVs. I might, because I came from the hospital, I might be able to this. I'll send you a picture of what the most looks like.
Okay.
For now, I should. Okay. Hold on. Because this is not I carry every day, but I luckily had it in mind. This is delete. If you see, I will put it close. This is your delirium screening tool. I will give it to you. How you will come to know this person has delirium, and you can always keep it. If you don't remember, you can check with yours. This is the donor thing that I was telling you before. This is the cam. And this is how you move your patients. And this is what I wanted to show you. Do you see this graph here? So,
It's a little far. Okay, yeah.
and then at the back, it says on the top, if you look at it, it would say DNR M1, allow natural death. No, with supportive care, symptoms management, see here. First tick and nothing else, right?
Yeah.
That means you only give oxygen. You don't give anything. If you choose to have your most this, we'll only do one thing for you. If you choose to have DNRC2, we will give you oxygen and we'll give you some drugs.
Okay.
So based on this thing that you see the line down here, it's called full code, CPRC2. You do everything to save me. I'll give you a copy of this one. We'll photostate this one. In the you would remember this. This is very, very mandatory. You need to, but it's with time you will learn it. It doesn't mean that you have to learn it now, but if you don't remember, you can always keep this up with you. And this one is, you can scan it anywhere, a screen, where it will ask if you need support worker to help you. See, psychological, you don't know what to do. This, if you work with a facility or you work with Fraser Health. I mostly work with when I started up teaching, because you need to have all these things. When you work with Fraser Health or any residential care or any facility which is under Fraser Health, they will give you these supportive instruments that you can reach out to. Okay, so that's when some people can get help, some people might not, because I choose not to get help and the other person chose to get help. There's no criteria, there's nothing that you have to pay more or less to get this help. No, it does not. It's your choice. Some people say, oh, I lived 60 years, I don't want to live anymore. If I die, let me die. It's up to them.
Makes sense.
So we don't decide, it's them deciding for their fate what it is, how it will go. Would they feel like their journey will be smooth if you allow that. But then what we do is only oral care, give them comfort, get them blanket, wet their lips, put some moisturizer. Those are the things that we do. We do not do other things for them. You
How
don't.
about if,
Yes.
sorry, how about like, let's say that they didn't want it at first,
Mm-hmm.
and then, like a little bit on the way, they said they changed their mind. So
Yes. If they don't want first, they always can come up. This is when they will bring this concern up. You will call the doctor. Doctor will talk to them. That time, he or she would be asked, why did you decide to do this? Is it under some pressure? Does it mean we have to also make sure that this is not under pressure or the patient is with the mind set up. I'm confused today and I will say anything. No. Then if they want to change it, we always bring in the family, the next of kin. Remember the SDM or the next of kin? He or she would be called up and then it would be discussed. It can be changed anytime.
okay.
Sometimes they choose full code. They want to be a full code initially, but we try to tell them that your loved one is a 94-year-old, 96-year-old. Some 96-year-old people are quite good and healthy, but some, they are hardly like, what would I say, 40 kgs, 40 kilograms, 50 kilograms. They're just bones. They're so fragile. Do you want them that they won't die of anything, but they will die when we press their bones? We'll crush them. So then the family thinks, oh, and we also let them know, if you want to go for a surgery, what would be the prognosis of the surgery? It's already, everything is decomposed. What you can bring back? So that's when we convince them. Sometimes it's very hard to convince them. No matter what it is. We had a lot of time, patients and clients who were full code and were not in a state. Just because they were short of breath and we had to do CPR, they might have lived with only oxygen for a while, for months, but just because they choose their fate to get the CPR done, they passed. When the first CPR was done, was pushed, their chest was pushed by our hands, and there's always a board underneath we put, and then we resuscitate. We push the ribs right away, through and through, in their other organs, in their lungs, liver, and blah, blah, blah. Sometimes the fat, if small molecule, a small, what you say, molecule from the long bones, as I mentioned, it travels through the blood. By the time they're talking and we think they might survive, goes to their heart and blocks it, they suddenly die while they were walking with a walker. It's just because they had a fracture. That embolus or thrombosis, that's why people who our elderly are always on blood thinners. Always on blood thinners. The problem with the blood thinners is if they get hit, they might die due to bleeding, because blood thinner, what would happen? Faster, it will not clot properly, but at the same time, it doesn't clot, it flows through their body faster. There are no fat molecules that can block their heart vessels or other organs that can cause death. Brain. So everything has a good and bad advantage.
Okay, thank you.
You're welcome. Let's come back at 10:30. How is it? Yeah. We'll discuss a lot today. Everybody is back. Okay. We were just talking about this pocketing. So, how would you prevent pocketing? A good thing we do is giving giving crush food, minced diet, and then still pay our clients and they are pocketing the food. Whenever you serve the first food, make them swallow, give them directions. Once they are done, if you have to double check, the best thing is to ask them any question and they will answer you back. If you ever think when you have something in mouth, keep some water, a little bit of water or something in mouth, and then try to speak. Would you be able to know? The first thing you do is swallow it down, then. So that's how they will answer you. But when it comes to pocketing medications, if it's not crushed, they're easily being under the tongue or by the side of the teeth. If it's food, they cannot pocket much just because we can, once we feed them, we start talking to them and we ask questions. Oh, did you like the food? She has to say yes or no. When she says yes or when he says yes or no, it will slowly go down. They have to swallow. So those are one more thing. The other thing that we say is you might add some flavors in it, depends on what the client like. And if ever the resident does not like, let's say medications in applesauce, try to get it in fruit legs. Fruit legs is sweet like dates. It's a paste. Whatever and however sour or bitter you mix together, it will still blend and will give good taste. But when you mix medications with applesauce, oh my god, it tastes the grossest ever thing in life. So do not put, I don't say don't use, I use applesauce. But if it's crush meds, they're very bitter, they're antibiotics. No. If you think the person does not like apples, no. You can use puddings, you can use thickened juice always to allow them to bring in a good taste. Sometimes you might give them a pill and tell them to swallow, give them some Ensure to drink. They, and then once the Ensure is in the mouth, the tablet is in their mouth, you ask a question, it has to go down. So those are all your tricks, which by and large you will learn when you work. You will see people doing different things, and then you will follow your own brain how what I should do at the point. Please make sure once you are feeding someone, they should be in an upright position. If they are way too back or if they are eating lying in the bed, they might be at a risk of aspiration. Aspiration does not only mean they choke, but because you are feeding them, and if you ever realize our food, when you lie down, the food will slowly go towards the backside, and which is our airway. That's why they get pneumonia. Aspirated pneumonia, if you ever heard it, aspirated pneumonia. It's that whatever drink they are drinking, whatever fluids they are drinking, it's going through the backside. So please upright position or up in chair. If the patient cannot be moved, it's very, very heavy, just lift the head of the bed up, feet elevated so that it becomes like a chair and either be feeding or he's self. So that's also something important needed when we talk about these disorders. Now, toothbrushes, we don't when we are uh, trying to help our elderly, we don't push too much. We give an opportunity first to our clients to brush our teeth because they know how deep and how fast to go. We might be putting pressures which can lead to ulcers and which can lead to harm in their mucosal cavity. Again, if you see somebody has tooth and they are very scaly, you can always you will see those, they're called pinkies, fluid normal saline in pink bottles. You can always forcefully like spray on it and it will come out instead of poking it with a what is it called, thread, um not only thread but those filers that they have for their dentures or toothpicks. So don't do those things. And then not this one. One more important thing, if you see you are taking care of a patient and you are giving them eye drops, please make sure the head is tilted, mouth is empty. If they have the spit in their mouth and you put eye drops, this E and T is connected to each other, airway, nose, and throat. Once you put in the air, it reaches here and goes down. They might have to swallow, but they don't know. They have saliva in their mouth, they might choke. To reduce the risk of choking, please make sure if you are giving any if you are giving any eye drops or nasal drops, the mouth is all empty. Soft brushes, soft bristles. Ask your independent clients, did you brush today? Was there any blood? Uh, maybe your teeth, are they bleeding? Keep on asking questions from them. Use very soft bristles brushes. See, these ones, they are those electric ones. And this one that you see is kind of a crooked one. It's for those who have arthritis problem. This is the other one that gets connected to the hose. And once you press it, it starts throwing water here and there between the gaps of your ears. So you don't have to rinse your mouth. Rinsing your mouth not only after the food, the patient eats the food, or but also after specific medications. If the patient is on puffers, then you will ask and you see puffers, creams, always in facilities, the nurses will let you know. So your as you don't have a scope of practice, if you're comfortable giving, you can always give. And we do those favors because we know the nurse, she's from my place, or she's connected somehow to me. We do give. But again, when you are doing these things, think of, am I giving harm or what is going on with you? Because if you're not covered, you're done. You are, for them, they do write K-RAID or HCA applied. Have you applied? Did you know how to apply? So those are some of the things you might have to again look into. We always have mouthwashes. Give them after those again. See, this one, she's just trying to gargle. She's like this, but you always have to sit upright, or we call it as high follows position. The way right now I'm sitting, it's a high follows position. If it's back a little bit, it's called follows position. She's lost her teeth. Uh, we don't we don't do that just because you have to put your mouth fingers in one finger in your mouth. So we don't want to do that. If they want to do for the loved ones or the patient himself or herself wants to do, welcome all the time. Dentures again, put them in a cup. Do not put them dry. Put some water in it so that they don't get dry. They are very expensive, and they don't get lost. Sometimes it might be it was done long before the face changed. They might swallow also, small ones, or if it's one tooth. That's why it needs to be asked if we are going for any procedure, MRI, CT, or anything. Soaking these dentures is a polysip. It's like a tablet. You put it in water that prevents the breakdown and fungal spots on the dentures. Now, dry mouth. Dry mouth, how would you explain dry mouth? It's just that saliva is very important for our teeth and gums. It also lubricates our mouth. It helps us to roll the food. It allows us to swallow the food. So it has, but when it comes to some of the diseases, we do get dry mouth quite often. And then that's when it starts to give them discomfort. They start to have ulcers. We, as care staff, our job is to help them getting out of there. Mouth products, we use Vaseline. See, told you there's a tube that you use. Grab a, what is it called, a swab, and do it with that. This is cold sore. The medication for this is acyclovir. You always put acy, you don't touch it. It's called contact precautions. If there is any, oh, I haven't gone through this contact precaution. Let me go through this. We have contact precaution when it is diseases related to skin. If it is just like this person, he is 1 to 2% assessed, he has ulcers, he needs to be seen. So that is when you say you will be the one who will again check and make the difference. Is this a bed sore or is it due to some medication problems, not being given or being given overdosed? Some people make misuse of this benzoyl alcohol. It's used for pimples, it's used for blemishes. They use so much that the skin gets burnt. Treatment of canker sores. The best treatment is soil rinse. Just put salt in the water, let them rinse the mouth. This is best one. Do not use hydrogen peroxide. One of the reasons is it's not available frequently in Canada. The second thing about this hydromorphone and this hydrogen peroxide is, if you ever seen concentrated, it will burn everything. It just removes the debris. It will leave nothing there. Imagine you putting hydrogen peroxide in mouth. What will it cause? It will make holes. And if your canker sores do not get better, you will have to call the, what is it called? Dentist. Not only dentist, sometimes it's a problem with your vitamins, vitamin B12. Now, so right, making sure you use the right paste. And there are enamel paste, you can buy them. You can daily rinse it with fluoride and fluoride gels. So that thing. Brush your teeth at least morning and evening also. Now, you are not supposed to do this. No, you do every care, but you don't do this care. I haven't seen in my lifetime anybody hardly doing even once, what is it, tongue cleaning. We don't do it. If they want to do up their own, yes, welcome, but you don't know it because we don't know how much pressure is going on. You might not, or she might not say, it might create ulcers, more ulcers. So we don't want to do oral health care series. It's important to know the oral health again. Our tooth, oral means our tooth, and our tooth is directly connected with the heart. So if ever there's an infection, it goes to every organ faster than you even think. We have talked about it before. It has to go small. The basic thing that we are doing is oral care basic, that is brushing and foaming the patient, brushing techniques and oral healthcare projects, considerations with dementia. No, this is not it. Okay. The important thing here is the care starts with oral care. The care starts with sitting up the patient, feeding them with a breakfast. And if ever they don't like this, they do still look for the previous nurse, then again, dementia or any underlying infection. And you always ask, oh, is this a new confusion or is an old confusion? They will let you know what it is. And then now we have considerations for palliative care. Again, palliative care are those we don't mostly do anything, or and the pain has spread to other organs, which is very, very dangerous. Brushing up mouth care, gums, see what we do. Today I am very tired. I have 3 days in 3 shifts back to back. Dentures need as much care as natural teeth. Yes, again, if there's infection in the dentures, you put them in the mouth, you're allowing them to go into the tummy infection. It's important to brush the mouth and the gum of the denture wearers. Be very careful while you're brushing. Toothpaste will scratch dentures, so you always use that foam soap, or you have, it's just like dispense medication. It's soft, around a little bit bigger one. Once you put it like an aspirin, it dissolves, but it's not an aspirin. You put it in water, it will protect the dentures. Line the sink with a cloth. We don't do that. Dentures should be taken out at night. I already told you. Dentures and hearing aids. Hearing aids should be again put for charging and bring back tomorrow. Bad breath, that is also the other name for bad breath, is halitosis, and it's often due to poor or oral hygiene. Again, a quick note to please make. Sometimes you will, when you talk to your clients or your residents, they smell like poop. Honestly, when they say hello, it looks like they open a gap of bag of poop. It's just because it's simple as that. It is affected. And another thing that I would say, mostly elderly people have halitosis. They're constipated. It goes, our GI system starts from mouth, but the end product of our GI system is anus. They are not able to poop. They're constipated. It gets accumulated, small intestines, large intestine, stomach. And while they talk, they smell poop. It's just that they are completely full with poop. For those patients, we need to give them lactulose, we need to give them peg lights. There are some medication, they're not medications, but that is needed to be given as to the patient. Sometimes the clients have hemorrhoids, and just because of that, the poop it doesn't come out. Hemorrhoids are big. Then I've seen it. They used to do it before in the residential cares. I never did it before. I haven't done it, but I've seen most of the nurses doing it when we used to take our students for the clients interview. They hang them. Once they hang them, ask them to hold the ceiling lift. They put pressure and they put a pad on under the bed just right away when they're hanging them. The pressure, they're holding the thing here, and then they ask to push. It just right away comes out. Yes. So you might see those things happening in the facility. Don't just get surprised. You already know it. Oh, she hasn't had a BM from past 2 days. The nurse and the CHW will be like, okay, I'll give her some lactulose and then you can hang her. Okay, that's about it. Any questions for now for this? Till I figure out the next one. Sorry, I was so really very, very sleepy today, just because I had a couple of shifts back to back. Yesterday, day before yesterday, I did the whole day and night, and then I continued till now. So that's why I'm losing it today. Anyways, let's see what we have next. And you will see if your patients are constipated, this will smell like poop when they talk. That is one of the reasons why they're hallucinate and they have halitosis. Sometimes it is that they have toothache. Sometimes it's that they don't brush properly. They have a lot of plaque. And also sometimes just because they pocket under the dentures and those dentures smell gross. I wish we could have had a chapter today. That would be wonderful. Going back and forth. Canadian Cancer Society, I don't know what it has, but we can go through this after the best. In women, breast cancer very common here. In men, lung cancer very common here. Because they drink more, they smoke more. FYI. I don't know what's in this slide. Let's see. Any lady with a shaved head, you should think, yes, I'm correct. My diagnosis is correct. She has cancer. Or she's supportive of cancer, like she supports it. You don't look. Now, how do you give honor? How do you give memory? How do you do this? I told you when they come in their residential cares or in their care homes or their home support, they do bring old photos, they bring their albums, they bring their old achievements or their husband's achievement or the wife's achievement, and they stick it to the wall. Sometimes you might see small cards created by small kids, grandma and grandpa, we love you, so all those things. Other than that, harmony and memory, they again go hand to hand. If they don't have an infection, definitely they might not lose their mind. But if they have an infection, they will lose. They will not be able to retain. If you ever see then anybody who's very confused and you don't know what is wrong with this, make sure right away send that urine for culture, and you can collect urine and send it for culture. The only thing is you should not be collecting it from the bag, because that poly bag is already there, and it might allow the bacteria to grow. What we do, we get a scissor kind of, it's a blunt scissor, clamps, we clamp it. Once we clamp it, there's a tube, we pull from there the amount of urine we need to get. So do not touch. Fundraising, educating about prevention, advocating for all Canadians. How we prevent cancer. Okay. Today's topic was very good, unfortunately. Child abuse and neglect. I don't think so. There's any child abuse, mostly here in Canada, because every child here knows not to hate, not to get hated. Police will come, they will take the patient child away. It will be for foster parenting. So healthcare child management sessions, they start with child maltreatment can be categorized. If how we can pick up the signs, we look at the kid's size, normally how much he or she should weigh. We look at the signs and symptoms of having any bruises, cuts. We will also take a verbal from the client and the client's family, that is the son and the grandparents. Again, physical abuse may include shaking, the choking, the biting, kicking, burning, poisoning. Yes. Holding a chair underwater. They do say most of the times they say like that, and they say that the kid is involved in other things. Neglect, failure to provide. Anybody who is not able to, who's not ready, or who's not able to, is a neglect or failure to thrive. Anybody can give me a good example of failure to thrive that we do daily in our life? Think quickly. What can be a failure to provide? You will have clients or patients. Oh, what's the diagnosis? It's FTT, failure to thrive. What does that mean? Anybody? No one?
The person doesn't want to live.
Okay. Or if he doesn't want to live, yes, but when it comes to they don't want to live, we put them under a act, which is which prevent them from suicide. But failure to thrive are people old,
Who
not cook food. They can cook their own meals. They can clean up their own place. But the thing that you said is also failure to thrive, but we always put on side of it failure to thrive, suicidal attempts. Okay?
like failure to thrive means like you don't want to do the daily chores
No.
and
Failure to thrive means he or she is not able to perform.
to perform the daily activities. Yeah. Okay.
She can't cook, she can't eat. Even though it's cooked, she can't eat because she needs to put the stove on. And her hands are shaky, she no longer can do. Then when she tries to get it, it falls off the plate, it falls over other things. Emotional maltreatment, when we tell our kids or we tell our loved ones, you know what, I really, really, really beg you, I love you, blah, blah, blah. And we get to get a thing done. So that's when we are talking about. And mostly families who are working are becoming a case who have to fight for this. They really um, mistreat some of our clients because they do not want their money to be spent. We have a family. I don't want to say the name. I don't want to say the nationality. Every other day that lady is in hospital. She's 96 years old. The both daughters, we try to tell them there's nothing wrong with her. It's the same dementia, and there's a pill that needs to be given to her. They still bring them down because they don't want where she would end up. She will end up in a private or semi-private room, which they have to kind of pay from her pension or from her pocket, but they use it for themselves. What they do, they just bring them somewhere and that's it. That is emotional maltreatment again. Public Health Agency Act. Biological fathers, biological mothers, stepfathers, stepmothers, siblings, other family total. Okay, what we have to do. And it says you need the read this in English. It's under the wave of 2003, and in the other one is for it doesn't say 2004. Okay, the one above is 2003. The below one is 2000. It doesn't make sense. Sometimes your clients will try to kill the kids. Yes, their own kids. They do want to kill. These things are also said. So be very mindful about it. But there's a very big difference that I personally saw from the fact that since COVID, the drug was way too high. But now this year seems to be okay. Initially, the drug abuse was very bad, but it's now better than other sections. Canadian incident study of report, Alexander report is personal. We don't have to do this. Next. Pushing food in the mouth is also considered to be a we can say maltreatment. Pocketing, all these things. Canadian hearing aids. They have hearing aids, they still are not able to hear. Take them out, open them, see if they're chargeable hearing aids or if there are batteries. If it's the batteries, it's always by the nursing station. You always have those by the nursing station. You can't king them. Guys, can you see my screen right now? The evolve screen?
Yes.
Okay, I will hold on. So what we do, I'm sharing right now an evolve screen. When you go evolve, put your numbers in, your password and your name and username. Here, see, this is course. So it tells you what is the announcement, when you press this, what are your grades, how will they look like? And then there's a question bank if you want to see it. Anything blue that is there, you can access. Anything red is for my access, and if I give you the access, then alone you can see. But blue is all the time, and you go in this underneath here, HCA, it will show you, and This one. Yeah. So you go under this and you will see your chapters. You will see the next thing that you were supposed to do, a workbook, which you guys haven't done it, but promise to do it, and before exam we will finish it up. And these web links we have been looking forward for. If ever there's any question, any confusion, you can always ask. And whenever you are working, if you are working in a semi-acute or acute region, you will also at times act as a porter. That means the patient will be moved on a stretcher bed or on a wheelchair by you guys. So you will be the ones who will push them and take them to the right place. Oh, this page no longer is there. Good job. Though this page is very important, this is our the little boss here who pays for this. Family violence, husband beating, mother beating, all that is family violence. And these are government's websites. Okay, one important question. Sometimes you might get a call. I need a pizza. And you hear bang, 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 lot of knives. No, we don't sell pizza. The answer from your side, do you sell pizza? You would say, no. She said, yes, 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 I know you're selling pizza. My address is 2665. Remember, if she told you back again, yes, 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 it means she's in danger. That is the code that they're using. If you don't know them and they give you a call, you just pay them. You just say, oh, I'm not this. They will repeat back. It means it's danger. Then what would you simply ask? Uh, do you have anybody else you're sharing your pizza with? Oh, he's just by the side. Okay, okay, try to be there. We are coming. You please get us the money. That means he's trying to tell them you be safe. So those things you will see, these scenarios are very common. And also during COVID, when we were giving so much care, some people still were carrying knives and they wanted to kill nurses just because they're not robots. They have 2 arms and 2 hands that they were doing. And the care aides, the CHWs had the job to do the vitals for everybody during that time. It was very, very kind of bad times. Oh my God. I don't know anybody who has worked with that time. It's seriously the worst ever we have seen. People could make lines and buy stuff, but people cannot see their loved ones while they have passed. Not all live 100 years. Some live very small, short for a very short time. And another thing, if you see your clients, your residents, they are just there because they need comfort care, and you will hear there will be a groggy sound like something. You have to let your nurse know, but that she or he needs to give them a medication that can reduce the amount of saliva that is coming and allow for the patient a peaceful tata bye bye to this world. Okay. Now, there's another topic here. We haven't done this. No, we didn't do this one. Psychologically safe team. Again, this is you ask your patient would only knock, it means there is danger. If she says, I need a pizza, yes, 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 I told you I need a pizza with vegetables only, no meat. So you understand. It's there? Yes, he's there. Can you move to the safest place you can? Don't sit in the room. And then when they're aggressive, try to move, keep on moving till you have the exit right at the back of yourself. Okay. Anything that is that contains blood goes into biohazards. Anything that goes, any fluid that contains platelets goes into your biohazard bag, and your biohazard bag is mostly in the washroom, dirty utility room. There's nothing to explain these slides. Can you, Prima, do you have an access to your online?
My online what?
This,
I tried it. Yeah.
how about you, Prima? Nima has it. You have it? Did the school help you?
No, ma'am, I don't have access.
Not yet.
It's the
No.
one that we were logging
Yes,
into.
yes,
Yeah,
yes.
yeah, I have access to it. Yes.
Amrit, do you have an access? Have you tried?
Access to what?
Yes. Have you access? Do you have an access to this evolve?
Yeah, I have an access to Evolve.
Okay. Let's do a quick homework for today. We will go through these, right? Links, not the topics. Links. And then once the links are there, we can talk about, one person can let me know what you had when it comes to safety. The other one would say, talk about feeding, pick up things, two topics each, and then you guys will discuss. I will see how you will explain to each other how the system works, how you will coordinate between yourselves. How is that?
That's good. Yeah, that's fine.
Okay, so these topics that we have covered for session 1, you would go, each one of you would go through these. It's not a big deal. You don't have to cram them. It's just that basic common sense. And then you will kind of play a role and try to tell us how you are a confused patient. Okay, the next one would be how I will deal. Each one will get a chance to discuss each thing, and I will see at the same time I can tell you what needs to have precautions and what is wrong. If this, I would tell you guys, you're keeping the same record on, and it's not helpful. Let's try a scenario tomorrow. We would do one thing. We will, but Prima, would it be easy for you to go through these slides, because they are more aware of all these things? You haven't done it. If you feel difficulty, you can text me. I can help you. Okay, but you guys also can ask for help. Doesn't matter, you won't get it.
These
Yes.
slides are there in Evolve.
Yes,
Everything's there, right?
yes. Do you guys want to see how we go? You guys
Yep.
will put your, let me go out of this evolve first. Hold on. I better shoot. So quickly, I want this to till we get to the lab. And Amit, when are you coming back again?
Uh,
Can you confirm?
I'm coming back on 11th. I'll be available from 12th.
Okay, 12th, we'll try our best to do it
Yeah, as of now. But
as of now.
if I get,
If there's any changes, we will
yeah, I'll
accommodate
let
you.
you know.
And you will have 2 more students starting tomorrow, I believe. So you
Good
guys
for
will be a good,
good for Mars and Dishan.
yes. So you will all have. That's why I didn't want to start a topic. I just wanted to go on the links. It would be very boring for you guys to listen to the same story again and again. You might not get interested. So, okay. Here you would write evolve, E V A, and evolve elsewhere. For me, I am a teacher, but you will go on the student one. Okay. When you go in the student one, you will go, it will tell you your account. I have to log out, then I can go in. Okay. Sign in, go on the corner of sign in, put your email IDs, the one that you got, and continue. Then put the password. The password for you guys is the code at the end of your book. Okay. Then you will see this page. Under this page, go in the last book. This is your book. Okay. Now, healthcare aid, HCA, course content. Under course content, there are two things. HCA 1020, the other one is HCA 1010. You go in 1010. Press it. You will see your thing here. Move it up and down. It will tell you all the links.
Okay.
You will also see with your clients, residents, a calorie count chart. A calorie count chart is when people are failure to thrive. They don't want to eat. They're not hungry. Because if somebody doesn't eat for years and years, they're alone, they're depressed. They just get used to not eating. And they don't eat enough or they don't eat good food. They get malnutrited. That's when we call them failure to thrive. They cannot live off their own. They need help. They need to get connected to support worker. They need to get connected to the home health. Home health will be, maybe we will be working in home health. So it's like that, helping them, feeding, drinking. Another thing is, I'm just looking at this. When it comes to alcohol, when it comes to drug abuse, you act as 1:1. It's called sitter. You will be your patient, your client might be restrained. You are just guarding the patient should not run away. And the ability to think and answer is called MOCA, MOCA, mini mental scale. So what we do is, if the MOCA of a patient is less, it's lower, then we put them under Healthcare Act. Those people, they cannot come out of the hospital. Even the family is there, they cannot go unless they are stabilized according to us. If they have to leave, they go AMA, against medical advice. You will see it in these slides because these are important things. You come up here, he's wandering, he just want to go home. The nurse will say, I can't help him, he needs to be here. What do I do? You ask, what do I do? The client wants to go. You are saying he should not go. What do I do? To whom do I listen? Yeah, just ask if you want to go AMA. You ask them, okay, do you want to go AMA? Oh, I don't know what that is. Against medical advice, because we want you to be in the hospital and you don't want to be here. You want to go. Yes. Can you please sign this form for me? They just write, I want to go home, I'm tired or something, and then that's it. Then we file it and you are safe, good to go. Okay, am I clear? Any questions? Hmm? Think. So please make sure to remember, if you are giving again care, respect, safety, stay away from the patient, make sure you know the history. You don't have to diagnose, but at the same time you should be knowing the history. Oh, this patient, she's having asthma, just let her breathe through the mouth, so you know what is going, or just keep a watch out, she should not pull her nasal prongs. That's when you need to know the nursing diagnosis, what it is and what am I doing next. How will I perform it? Okay. Home care association in this one is very, very important. Very, very, because home care association means you. Again, it means you. In that case, you are given a chance, you are being taught, you are being given delegation of task. That is, you give all meds, including IVs. That's why you should be properly trained over this. Am I clear?
Yeah.
So please go through these topics and then we can come back and talk about this. And I'm a little lost as well, but I don't wanna.
I'm not able to open my, like there's a code on the back of the first page or at the end of the book, which
I
needs
think
to be
it's end of the book.
Okay, I'll have to get it.
Let's do one thing. Hold on, my dear. Hold on. Why do I create it like this? Okay. Hold on. Hold on. Let's make it easy. I know you're not. Stop. See. Now, is it on my desktop? Yes. Let's copy. I think I should open it like this first. I will send it to you guys so that it's not. My brain is a little bit slower than today, unfortunately. I'm not dementiated, but I am. Seriously. So, on top, so what I will do. Oh, sure. I don't know. That was a sleepy mode. Why isn't it showing share? Why on the other wrong side? Share file now. Okay. Did you guys get it? Anybody got it?
Yeah.
not, I will email this to you guys. Okay, I will email this to you guys for now. If you don't get it, let me know on the WhatsApp. I will send it to you guys. I will email it to you guys, and we can maybe just because if I stop
What's the
sharing.
name? Dwayne. Last name? Daniel. I'm gonna take pictures of it.
Okay, guys. I will just send it to you, this one, in your emails.
Yep. Thank you. गोपी वाला glitch है? अच्छा.
Okay, guys. Okay.
Yeah. Oh my God.
We'll finish this, and then this one we will be able to. Are you still able? Yes, you can press on these and they work. So please make sure that you guys go through these ones and see. I double check. If you press on it, they all work. They all work. Do they come up as your links, or do they not come up as links for you guys? Can you press them? In the
No,
chat box,
it doesn't come up as a link.
they don't come up as a link.
It's just words.
Yeah.
So I'll email it to, I'll see, I will email it because you don't have an access. I will email it in half an hour for you guys. And then you can read them. Tomorrow, let's pick one person each who would speak up, and at the same, I will be your helper. Then the other person, I will be the helper, and we'll make a scenario. We'll set up like scenarios. How is
Okay,
that?
so each person has a task, like
Yes, I'll pick up, just like I would say brushing up on the mouth care. How would you do? I'm your client. Can you briefly explain me what I have? And I might act weird, and then I would see what would be your way. You would be trying to help and accommodate my needs. Simply neglect. I will pick up somebody with neglect, and I would say I will be the difficult person, and you might have to use your skills. That's just a reason for them to know what and where to access, what to do. Let's see how we can do. Okay. If you guys couldn't do it, we can always again come back and go over with all these things. I don't think so. It should be a difficult thing. We know our focus. Please, DIPPS. Make sure you don't forget your dips. Your dips should be there. Oh, you call me by my name. You introduce yourself, which is giving dignity, respect, knock the door. Remember those things. Introduction, what I'm going to do for you, how I'm going to perform the care, all those things. It would be a scenario like that. I can't hear you. Oh, are your hearing aids on? Yes, they are in, but I can't hear you. Have they been charged? Is there a battery working in it? No. We'll pick. This is the main reason why they are telling you to do is. Otherwise, would you go to the hearing services? No. If you have to get free services, anything for elderlies is free in Canada. Anything being a newborn to a 12-year-old is free. Once they cross that, then they have to pay dental, then they have to pay the hearing test, then they have to pay for their vision test. But by the time they're covered by different policies, kids policies, elderly policies. It's just the older adults cannot get their eyes tested for free. The age group after 16 to 60, they can do it. They have to pay. Hearing it, they can do it for hearing test. But those they are in low income, and these they are in low income because they don't have any income. Kids cannot have any income. Older adults, they have no income. Their income is their pension, which the government is paying them off. That's they know they're not making it from anywhere. And other than that, if you are aware, if patients, clients are sick, they undergo any tests, and after they go to the test, they see if they have cancer or they have not only cancer, other malignancies. Right away, this cancer society, this lung cancer association, and different cancer associations, they come and connect with them. They want to get samples from them, biopsy samples, and they want to do a study on them. That's main crux of this one. That's the only thing they have to do. But when it comes to just with women, you want to do pap smear. It cannot be done for a young girl. It cannot be done for an unmarried girl. So there's a criteria. That's why they want you to look at it. But you, as a support worker, do not acknowledge those. You do not tell them where this is. You only say, hey, oh, I'm here because I fell down from staircases while I was working. Okay, this is here an occupational health and safety pamphlet for you. Would you mind going over with this? And then you will get connected with your hub. That's why they want you to know this. They don't want you to know the content of it. What you would do. This is not, would you go and grade them the hours? No. It's just that, oh, I'm so sorry. We treated you, but at the same time, here's your pamphlet. This gives you information about occupational health and safety. And there's a number, toll-free number, blah, blah, blah. This one, you can call it anytime and get your case managed. Please keep your number and go over with the directions. Okay. Canadian Nurses Association. I told you the Canadian Nurses Association is BCCNM, and midwives, British Columbia Nursing College and Midwives College. It was not midwives earlier, but now the midwives, or the other name for midwives is doula, the ladies who give birth to the newborns at home without medical support are the ones that are doula, that are called doula. That is just it's talking about. it does not have that information, but I'm just trying to tell you that information. And I told you already the blind in foundation. There's a card, there's a pamphlet, which is everywhere when you work. They will tell you on the day of orientation, oh, hi, you're going to work, you're going to start working with us. Please make sure anybody who is less than 65, make sure that they are being followed up by this donor pamphlet and they know what we are going to talk about. Okay. Department of Justice Canada, if you make an error or your clients make an error, where to go? Whom to approach? Your union. If the union doesn't work, where else do you go? Court. You go to the court. Okay? Am I clear?
Yes.
Is there any
Yes,
question?
ma'am.
Is there any question regarding this? Huh? What's this 599-537? Who's this?
I think that's the code to enter the.
Why does it come like that?
Oh, they're on a different. Oh.
It's okay. Let's leave it. Let's talk about what. Let's focus about our own topic. So that's when we have it. We might be able to, because I really need to know where you guys are at. What do you understand? Because till now we should have had one of the topics each submitted your workbooks, but I was not able to get it. I haven't seen you guys in the school, but I don't know, tomorrow would also be an online class. The next day when we will be meeting at school will be when you guys will hand over your workbook. Otherwise, it will be too much work for you guys. Except Amrit, unless he's back.
How many chapters do I need to complete in the workbook?
We completed, see what we did? We did, let's,
Around 11.
I think you will be doing it up till 9. We did
Okay.
an extra, we did, we have to do that, but we did it anticipatory because they wanted us to go over these slides. You saw these slides, you saw these links. I feel like we should be more focused on what we do and how we approach, what our scenario is, what our scope is. We can go on these links anytime, right?
Yeah.
But still, I didn't want to collect so many links that we would be lost one time. Other than that, tomorrow we'll have a topic where we will discuss, but we will again do a small scenario stuff with these links. Okay?
What are we supposed to do in workbook?
There's a workbook and you have to complete those. There are those fill in the blanks, true and false, and questions. You'll have to complete, but you did not do chapter 1 with me and other chapters. I might give you time. I think if we have tomorrow, we will be getting those 2 students, then we'll go over separately with the 3 of you later. If they want to join, welcome. If not, also we'll give them because they have already done it. And then you will get to know what I taught on those days and you can go and do your workbook.
Okay.
Okay. So till now you should be able to know you can be a CHW, you can be a support worker, you can be also a HCA. This is just a title of what we are doing. A health care AD. a support worker, or you can say CHW, community health worker. You have no scope, but you have perfect scope. Just because what your employer says, what your nurse says, and what the policy says. There are also residential cares where the policy says you're not going to give any meds, but because you are the ones who give care, can you unstrip the patient later and apply a Voltaren cream? No, you already anticipatory give it to your care staff and say, whenever you're changing, apply this on this area, apply it on her arm, apply it on her buttocks because she gets pain, or on her knees. Please and please, I'm again saying, make sure that when you are being given this task, you watch for it. If the area is warm, if the area is red, if you see something unusual, do not apply. First, communicate, because she delegated this task to you, and it's actually she should be doing. No matter what it is, you report it, you are responsible for it. You don't know what it is, so don't take risk. Yes, we always do give meds. We always apply. It's called, if you are working with Pyxis, it's called TAR, topical administration record, where they write, if the nurse gave you this tube and say, hey, you apply it, when the medication will come up, it will also show Voltaren, and she would say, applied by the care staff. So you are responsible for that medication. So please make sure when you apply anything there, where am I applying? Where was it? Which knee was it? Which toe was it? Is this toe red? What is it? Is it cold? Is it warm? What is it to touch? Okay. So all those things we will be thinking of about. And what else do we have? Just trying to think about. Let's see tomorrow about this, and we can do. Today I am not, I myself know I'm not that much very with it. Sorry about it. So sleepy, but I don't want to waste your time. Go over with with this topic and see what you feel difficulty with. I will explain each and everything for you guys. Was there anything that you couldn't understand today? Was something that you felt like was not being communicated properly? I can go, before we go, I can again talk about it. How is it?
Okay, that's good. Yeah.
Okay. How about you, Amrit?
Yeah, I'm okay. I just need that mail to discuss these things because I've opened my book, but I'm not able to get in. Like you are as a teacher, so as a student, I'm not able to go through these links. My book.
Your book. Did you go on the book?
Yeah, I opened the book.
Okay. Did you get into Evolve?
Yes,
Did
ma'am.
you see the course tool on your side, left side? Course content.
Yeah.
Under the course content, you see HCA 1020, HCA 1010.
Yes.
Go in HCA 1010.
Yeah, but yeah, I'm going over there into it, but
Double press.
hold on.
Huh? Did it open?
Yeah, I'm just sending you a screenshot.
Sure.
Yeah, this is the maximum I can get through announcement.
That's the maximum you're getting?
Yeah. Yes. Key points.
If you scroll up, it doesn't go beyond that scroll?
No, like the course content is
Yes.
HCA 10, then announcements, content updates.
You have the same thing, but scroll up, it will say reading books. Scroll it up. It's 23 pages.
Reading. Actually, I'm not able to access my ebook.
Mm. Do you want to get connected with Zishan, Mr. Zishan?
Yeah, I'll try later in the
Later.
afternoon.
Whenever you have
Yeah.
time, just drop him a message and ask him. It's
Yeah.
okay. If not, just right now.
Yeah, okay.
Okay. If not, then just let me know. I will send you guys this one in an email.
Yeah, that's okay.
No worries.
Ma'am, are we supposed to create our own account? Like,
No. You will
what
have
they will
this.
provide?
No, you will have it from the school. It's free from the school. I will ask. You know what? I will ask Zishan to help you with ebook. But because you're not at school, you might not get. You might not understand easily over the phone. But let's see what we can do. Okay. You don't have to pay for it. It's already paid. It's free from your book. It's in the book. I will add you here on this book and it gets free for you. Let me do it now. In fact. And then you only have to ask Zishan to get it. Course tools, roster and team. Amrit, Malali, Mariam Khan, Nima. Submit roster. What's your email ID?
Mine?
Yes.
PEM
PEM
CEE
CEE
250
250
@gmail.com.
Okay. And our course ID was this. Copy. Paste. One 166 this. PEME. Okay, my dear, you are added here. Okay. And now, come, submit. Then, what's your full name, Bhima?
Emma Chuki.
Just text me this, text me on WhatsApp, okay, sweetheart? I don't want to make, because it will be stay forever in this computer. I don't want to make mistake with it.
Mhm.
P-E-M-A, Bhima. C-H.
OKI. I've sent you, ma'am, in the minute.
Okay, sweetheart. Okay, thank you. Your email was P-E-M-A. Again, you have to write it down. Bhima. What was the number? Bhima?
Sorry?
What was the email again?
PEMCEE 250.
250
Mm.
@gmail.com. Should be there. Connect. Okay, darling. Can you see and can you check in your email? You will get a code.
Mhm.
You're already added.
Yeah, I received me.
Okay. So now you have this code. You can access your this one right away. I added you here. Okay.
Okay, ma'am. Thank you.
You're very welcome. Anyways, we'll just do it for tomorrow. And I think we will have an online class for tomorrow as well. If there's any changes, I will post it up on your group. Okay.
Mhm.
8:30 would be our standard time. All of you take care of yourself. We'll see you guys tomorrow.
Okay, ma'am. Have a good
Bye.
day.
Thank you.
Bye-bye. Thank you. God bless you all.
You too.